So thanks ever so much for doing this, Mr. Cowen. I know it'll be, for us, someone who's very shy and reserved, I know it'll be a very difficult 20 minutes or so, but I think it's really important for us all to reflect on what's been an amazing career. Over 30 years here in Hull as a consultant surgeon is amazing, and I think we've just got to reflect on a bit of it before you retire in a couple of weeks, which is a huge loss for Hull. Devastating loss, but obviously it's a good time to sit and think about some of the key aspects of your career. So over 30 years as a consultant in one area is a huge thing. What brought you to Hull, and what sort of the start of your career? Because it's over 30 years ago.
Well, I went to medical school and started my training in Leeds, and then went off to do my registrar and senior registrar training in Liverpool. So I was used to driving up and down the M62. Yeah. And in Liverpool, I'd found a main interest in thoracic surgery, and the post in Hull came up when my predecessor, Professor Magussie, who had established thoracic surgery in Hull as a very major centre, he retired, and the job came up, which was primarily thoracic surgery, but also included cardiac surgery and esophageal surgery, and it was an ideal job for me to come to.
And that brings it on to how the training was then, because often training's talked about amongst people of my own era, in terms of it being challenging at the minute. But just to tell us a bit about your own training, because it is fascinating to reflect on that, which is you've done cardiac, thoracic and esophageal surgery so successfully for many decades.
Well, I was very lucky training in Liverpool, where they had excellent training in thoracic surgery and a good cardiac centre, and the thoracic surgery in Liverpool, Mr. Ray Donnelly, who I worked for, had a very wide interest in esophageal surgery as well. So I was very fortunate to be there at the time I was, when Mr. Donnelly was setting up other things, and I was able to do a huge amount of actual operating in thoracic and esophageal surgery, while they say maintaining the cardiac surgery as well. And it was the ideal job for me to come to. It was very busy. It was a centre doing a lot of good quality surgery, and I just feel very privileged to have been able to come and work here.
Oh, absolutely, and I think one of the things often mentioned about, because you are a very humble person, is how so many trainees of different eras over decades now have learned cardiac, thoracic, esophageal surgery from you. As just the way the training's gone now, if you were a current trainee, how do you think you'd feel if you were in a current era, and any challenges you face?
Well, obviously the field has changed. It has become far more highly specialised. There is now the split between cardiac and thoracic surgery, which has been around the country and is in Hull. And I think I greatly enjoyed doing all the specialties. I was very fortunate in that I enjoyed it, and the results were good for the era that it was. But I do appreciate that nowadays it does have to be a lot more specialised, given the introduction of all the MDTs and everything else around it, and focusing on the results that are required. Have I enjoyed it as much? I think so. I enjoy surgery. I feel so privileged to be able to do operating. So if that was the environment I was raised in now, I'm sure I would have been happy with it, but nothing could beat what I was able to do, and I enjoyed it greatly.
I'll just ask on that, how the job plans change, because obviously we have well defined as consultants now job plans, and MDT working is very successful and a huge part of that. Was it just a lot more operating then?
It was a lot more operating, and when I arrived I was doing 6 operating lists a week routinely, and we would look to fill every other operating session we could, and operated at weekends as well if there were any acutes. That has changed, and I appreciate that it has probably changed for the better for the results around the country. I do miss the fact that a lot more time is now spent in meetings than in the operating theatre, but I can also appreciate the value and benefit to the patients as a whole from all these MDTs and the meetings around it.
I would ask on that theme as well. Did you notice the way trainees were, say, 20 years? I mean, it's a career spanned a huge time to the way things are now. Certainly, you know, at registrar level, now obviously a modern, you know, trainee of yours having, you know, potentially required things later on in your training. Have you noticed that?
Hull has always had a very good reputation for training.
Yeah.
It was when I arrived. I was very fortunate to be involved with it, and I enjoy training. Training in cardiothoracic surgery as a consultant is actually fairly easy because we have very motivated and highly intelligent trainees who want to learn. So they're obviously the best to be training. I think in the early days when there was far more exposure to theatre and there wasn't the constraints of the working time directive and other factors coming in, then yes, junior surgeons could get to an advanced level at an earlier day. But the system is what it is. There is working time directive. Training continues to be done very well in Hull, and I'm proud that I've been able to be part of it in the past.
A huge part of it. And I think one of the things that get across, because often we're asked now by registrars worried about you know, doing operations at an earlier stage is just keeping your motivation going, staying involved. Would that be reasonable sort of advice? Anything on top of that?
Whenever I speak to a trainee, I do not want to be the person that encourages them to go into cardiothoracic surgery. Yeah. It's a hard specialty. If anything, I would sort of let people know that it's a very hard specialty. Yeah. We're very fortunate in that people who want to do it, they really want to do it. And that's half the battle. So,
no, absolutely.
We're very fortunate.
And just on this, while we're on the training theme, what's obviously, you know, in an era where I remember years ago doing first open lobectomy, and then in the years before I finished my training, you're training me in robotic surgery. That's my. What do you think the challenges are now potentially, and they're described, but for someone who's obviously gone through the whole era of potentially not doing as much, even starting on robotic surgery? You got any thoughts on that?
I think that there is the challenge, and I think it was highlighted in the college journal this month about the risk as minimally invasive surgery, both thoracoscopic and robotic, become the norm, that surgeons aren't going to be trained in open surgery, which is obviously a highly required for the more difficult cases, and there is a worry to me that there is limited exposure to that.
Yeah.
With Hull having developed thoracic surgery and being so fortunate to have had Professor Alam purchase a robot and give us the facility to do that, we have been able to establish it in thoracic surgery, and it is probably the most major benefit that I have seen in thoracic surgery in the terms of patient outcomes and patients recovering from surgery.
Yeah. And that's something I wanted to ask about as well, because obviously in a career of where you've gone through, seen many developments, is there anything in you that keeps you being motivated to adapt and learn? Because obviously your legacy of one of many things is the fact that you're leaving a thriving robotic program in Hull as you retire. So what keeps you motivated to do?
Well, it's been such a privilege to do the robot. I have loved every minute of it. I enjoy operating. Yeah. That is what I was trained to do. I'm not trained to be in meetings. I'm not trained to be a manager. I'm not trained to do a lot of things, but I am trained to operate. And working in Hull in the job that I've been doing, I've been allowed to do that, and to be able to develop the thoracic service and for us to show the benefits to the patients, with over 50% of patients now getting home within 2 days after very major surgery. It is the one positive change in surgery that I've seen. But there is that risk that up-and-coming surgeons will learn robotic surgery, it will become the norm, and they may lose certain skills in open operating.
Oh, absolutely. And I think it sort of moves onto a theme, because obviously, you know, following the indications we've currently got, obviously with robotic segmentectomies is, I know we've spoken about it, but there's been sort of almost themes in your career, and I think segmentectomy is something that was practiced, fallen out of practice, and you've seen that in your career.
Yes, I mean, I was very fortunate to have been taught to do open segmentectomies coming up to 40 years ago now, and then to see the change. And again, thoracic surgery has had its issues. When I first started in thoracic surgery, the outcomes were not good. We didn't have staging procedures established properly. People were being operated at an advanced stage, and it had got a rather bad name for its results. But very fortunately, I arrived at a time where staging was becoming the norm, selection of patients became more important, the management of the patients on the ward with the physiotherapy meant people were surviving and we were operating on the appropriate people, and results have improved greatly. Segmentectomy going forward now with the introduction of the screening program with the lung health check, which again Hull has taken up very early on, is identifying patients with early disease, ideally suited to the technologies that we've been able to get in Hull with the navigational bronchoscopy and with the robotic surgery to perform these limited resections on these smaller, earlier cancers, which must be beneficial to the patients with the results going forward.
No, and we're having a lot of discussion about this on a day-to-day, you know, with each other, within the team. We just come up this morning from a list with navigational bronchoscopies. And I think that's, is there a, I mean, you know, you've done decades, is there a sadness at the minute with the rate of technological advance, which is particularly fast at the minute with diagnostic and robotic procedures, that you're not going to be, maybe persuade you to do a couple more years?
I think I've done 34 years as a consultant, and
I keep trying.
I'm very well. It's very kind of you, but no, I think that I'm very fortunate in that the younger surgeons, yourself and Mr. Tenzeris and Mr. Quadri coming forward, have all the technologies at your hand, and you will take it forward. And I have no hesitation riding off into the sunset.
No, and that's I mean, as I say, you know, to talk about you and your career is synonymous with Hull. And I think, you know, is it outside of the department, we'll come to the patients, you know, it's obviously an area where we have a lot of work. Patients coming through who we're very fortunate to treat. Is there anything about the other aspects of the area that we can sell to people who would want to know about Hull?
Well, I moved to Hull. I'd never been to Hull before I came to the job here. I mean, it's a lovely area of the country. It's got beautiful surroundings. The people are very friendly. I have been made so welcome, and we have an established workforce, which I didn't find in a number of other hospitals, where there would be a high turnover in the staff on the intensive care unit and on the ward. Whereas here, we've been able to establish teams and go forward, and many of the people that I work with have been in the hospital nearly as long as me. Not too many as long as me, though.
And I think obviously it is an area where there's a lot of lung cancer, and we're very fortunate to treat patients, people who are, you know, incredibly kind, want to work with you. Because one of the aspects in medicine at the minute is, and I suppose this has changed as well, is the idea of sort of shared decision making. I think, you know, that's been a big shift, I would have thought, over.
Yes, and I had some difficulty in understanding why we needed to sit in a meeting and discuss these patients, which I felt we'd managed to so well over the years by just a quick phone call or a letter from the referring physicians. But no, you go to the MDT and you quickly see the value of it, and you get to discuss all the patients with the disease, and they all have the input from all the specialties. So yes, we are now picking up a lot of patients that would have probably been missed, where we can suggest that there are better therapies for them. So I embrace it now But obviously when it first came in, I'm as resistant to change as the next man, and I didn't like it when it first came in.
No, absolutely. And I think in terms of how we'll move forward as a specialty, do you see any direction it's going as thoracic surgery?
Thoracic surgery, I feel there are many developments, and it is one of the most exciting fields to be in, mainly around the identification of these earlier tumours and the management of them, the technology with the navigational bronchoscopy and the advances that there will be there, the surgery with the robotic surgery. Robotic surgery is in its infancy.
Yeah.
You know, I remember mobile phones going from the brick to where they are now, and robotic surgery will do the same. Whether AI will come in and take over a great deal of what we do in the operating theatre, I don't know. Can't say I'm against it, but the worry would be then around the training of surgeons going forward as to where they would get their exposure.
And I think one of the things in the NHS is difficulty when you see things not happening immediately. Is that something you can give advice to people on? I know you give advice to me on it, so it's.
No, it can be a fairly slow ship to turn around at times, and I know, but you do have to temper the excitement of clinicians with the latest development, and I've seen many come and go that you did get their time in the sun but didn't make it, and very few actually do. So I'm not against there being a degree of delay. And I think that it does need to be managed carefully, because it's very expensive, and we need to make sure that we're managing the country's expenditure on health in the best way forward. Certainly there are times when it is frustrating, and we have a massive development in thoracic surgery at the moment with the lung health check patients coming through and an expansion there, and we probably do need to expand the services that we are providing to cater for that and keep Hull at the forefront of thoracic surgery in the country. So yes, at the moment I can see areas where we do need to move a bit faster, but for the latest inventions, they do need looking at fairly closely.
One of the areas that's becoming probably more topical outside of oncology in thoracic surgery is thoracic trauma. And I know often the best place, because it is topical, and we've worked a lot together on it over the last few years, which your support's been invaluable, is what's your opinion? Because obviously rib fractures, chest trauma has gone throughout your career. What's your opinion on the direction of the travel in that aspect?
Well, this is obviously something that you've taken forward very well, and we identified that you would be able to do that, and that's been my main contribution, is getting you to do the work for that. Thoracic surgery, thoracic trauma is very common.
Yeah.
The majority of thoracic trauma patients do not need thoracic surgery.
Yeah.
Thoracic surgery is a limited specialty with limited number of beds, and therefore it would be inappropriate if we would be looking to take all of the thoracic trauma. However, we are now identifying with the rib fixation and other managements specific patients who would benefit from our input, and to develop the protocols and guidelines to make sure that we get the appropriate patients referred to us so that we can operate on them in a timely manner, and to maybe not be swamped with the patients which will basically occupy beds that we need for other things, and can be managed better with the holistic care within the major trauma centre. But I think I feel my job has been done very well in getting you to make a start on the protocols for that.
No, because I think it's obviously, as you say, a great deal of patients, and in our region we've captured the numbers. It's significant, and there's a direction of travel, and I think it's always good to look how you've productively and positively managed patients for years gone by to have a bit of direction going forward. Has there been any other areas outside oncology that you've particularly enjoyed being, thoracic oncology, that you've particularly enjoyed being involved with over the years?
Well, when I first arrived, it was the very early days of lung volume reduction surgery, just as I started my consultantship. And I think we were one of the first trusts to develop a lung volume reduction for patients with COPD and emphysema, and we had excellent results. Unfortunately, the national studies at the time meant that got held back a bit in its development, but again, it's being taken forward, and Hull is now a very major centre in lung volume and reduction and surgery for emphysema. Something that I'm not involved with now, but I do feel proud that we were one of the first centres to start it.
Oh, absolutely.
And again, when I first started, there was mesothelioma was a significant disease, beating with the previous exposure to asbestos. There was more or less an epidemic of it, and yes, we were involved in the management and surgical treatment of mesothelioma more than probably other hospitals in the country. And although results were good, I do appreciate now with the latest studies that surgery in that area is felt not to be the best way forward. But again, Hull has a strong record in the management of mesothelioma.
One of the areas which we've noticed that we certainly spoke about, just between us as a team, is an increase again, and I know it's all changing at the minute, in pectus referrals, but you've obviously done a great deal of pectus surgery in your career. Yeah. Any thoughts on pectus surgery, which is, again, topical?
Well, pectus surgery is, yes, we had quite a large practice for pectus surgery in Hull, but then the funding for pectus surgery was stopped by NHS England, primarily because it is felt to be purely a cosmetic disease. And I would agree with that. There's no real evidence that it does affect the patients physically, except in the most extreme cases. But the psychological effects of a pectus do affect how these young people develop their lives, and that's something that I have a great deal of sympathy for. You get very good results with surgery, that it does now not involve a significant amount of aftercare after the surgery. I think I am a little bit disappointed with the way it's gone in the country, but NHS England has looked to us to establish specialist centres for cases to be done, but that hasn't started yet. I feel there's a number of young people at the moment who are having to live with pectus deformities, and it is severely affecting their adolescent life.
And again, it might be an area which we're talking about that training's becoming an issue in, isn't it? I remember doing them with you a number of years ago. Real interest is obviously chest wall surgery. Is that going to be, could you foresee a problem like that?
Obviously, if you're not exposed to it, then there is. I mean, I know there's a changing from the operations that we used to do to the more minimally invasive techniques, which don't actually appear that minimally invasive to me. But yes, if there aren't the cases and it's being restricted to 2 units in the country, there is obviously going to be effect on training across the board.
And on that, and just a few sort of non-surgical questions which are important in a career in surgery. Is there any advice on sort of how you've managed an exceptionally busy practice with how you balance it?
I feel that I've been fortunate to have a busy practice and enjoyed what I consider a reasonable work-life balance with it, and I certainly enjoy my family life with my children a great deal, and now grandchildren. The work, we were very busy and there was a lot of work to do, and the main way of managing that was to have a team, and what I've been very happy in Hull is with the team. Yeah. I've always had a very, very supportive team around me, both from the secretarial side, from the nursing side, from the people working with me in theatre, from the intensive care. It's a team, and if you've got the team behind you, which I've been very lucky to have, it makes the job a lot easier.
I think that's absolutely, we spoke a lot about. I mean, I've been very fortunate in my early consultant career to be mentored by you. that team environment is very much, you know, something that it helps you both professionally and personally. You know you're coming to work and there's that supportive environment which we've got here in Hull. In terms of just the non-surgical aspects to a surgical career, any thoughts on, and obviously you've many years a training program director, any thoughts on research in a surgical career?
Research is obviously very important, and it is important that a surgeon has a mind open to research and can certainly interpret research. A number of, I have not been involved in a vast number of research projects that have changed the face of the world at all, but there's just being involved and being able to appreciate what's going on and to critically look at appraise research that has been done is vital in a surgical career.
Yeah.
Is it a be-all and end-all? No, I don't believe it is. Other people are not focused on research as such, may have more interest in the management side and the administrative side, all of which are very important bits. But it is important that a surgeon is able to evaluate the research that is published out there.
Yeah. And I will ask you about this. I'll ask you from the trainees side, but obviously, and I've asked you a lot, as my consultant career has progressed, about training and how best to do that. If you were, and obviously you've trained, well, a huge number of people who are now senior surgeons, consultants across the face of, across the face of the world. And do you have any advice for people who are looking, because obviously you've trained very effectively, looking to train?
Provided you are looking and enjoy the specialty you are in and recognise that on the whole, almost to a man, the trainees coming through are highly motivated, then there is nothing more rewarding than training.
Yeah.
I love doing operating. I love operating individually, but it is a huge reward to get people who are motivated, want to learn, and to be able to teach them is very rewarding. And I've been rewarded. There've been a lot of surgeons, as you say, around the world and in Pakistan, and I've been invited out by them to do operating out there, and it is a very rewarding part of the job. And probably the most important, outside of the individual care of the patient in front of you, training and being involved in keeping the skills going forward.
And I know you'll be very embarrassed by me saying it, but obviously it's going to be a huge loss, like your retirement for Hull, for myself personally, for our patients and for the unit. And I think obviously all we can do is continue to work in the same way that you've had the unit going for the last 30 plus years.
And it's very kind of you to say that, but I have every confidence that you will take it forward and it will go forward and advance. I have no doubt about that whatsoever.
No, and as you say, the most important thing, the thing I'm here, and it's a real privilege, is to care for our patients here, and that's, I've got a huge amount to thank you for, personally and professionally. So thanks, Mr. Cowen.
Thank you.
I really appreciate it.
Okay.
Thank you for your time.
Yep. Thank you. Cut.
Hi, this is a message from Mr. Cowen. It's been an absolute honour to work with you all these years, many years. We were just talking earlier, he's done 40 odd years in the Trust. What an absolute fantastic achievement. He's treated so many patients, and I've had the honour of supporting him through some of these cases. We've worked together for many years, and one of our big things was we introduced the robotic thoracic surgery in this Trust, which we are very proud of, and it's great to have worked with him. It's great to work with him now, and I wish him all the best in his retirement and everything that he follows in the future. Thank you.
Yes, I feel Mr. Cowen's made a huge impression on the department and my own personal career. Since starting on the ward as a newly qualified nurse, has been a consistent part of the service for the nearly 25 years that I've worked within the service. Over the period of time, it's brought huge changes in the surgical techniques, the post-operative care with chest drain management. He's always been a good learning resource. He's very good to watch how he works. He's very cool, calm, collective, listens to the patient.
Well, my previous role, I worked in intensive care from a junior nurse up to a junior sister. Mr. Cowen worked and then at that time did both cardiac and thoracic surgery. He was great skill, knowledge, excellent at teaching and supporting the nursing teams. As Kerry said, learnt an awful lot of patient management through Mr. Cowen and his work within the intensive care unit. My transitioning roles over the last few years have been, and I've returned back to the service. Mr. Cowen's been here and very supportive within the thoracic team. He's very proactive, cares about his patients, and that is paramount. And you see that through his work and his dedication to the other team members and with his patient team. He's very good with the nursing teams on the ward. We all see him as a very kind, gentle man. He does have a side when there is the frustrations there that he does, let people know. But on the whole, he's been very dedicated, very supportive, and as a thoracic surgeon for the Trust has been absolutely amazing, and I feel that we've been extremely lucky to have had him working here for the length of time that he has done, and he will be sadly missed.
It used to be a little bit fearful for me as a newly qualified, the whole ward on a Monday, 2 o'clock on a Monday afternoon, he would finish his Scarborough clinic and come and do a full ward round, which was in them days was a very old-fashioned ward round in that the ward was shut down, there was no visitors on the ward, nobody spoke, it was all silent, and he would come and see the 10 up to 15 patients that he would operate on the next day, which now we only look at possibly 5 patients, which when you think back of the volume that he used to be able to manage and operate on a list was phenomenal. So there was that, and then I remember he used to do some joint surgical procedures, some esophageal joint with ENT, the pharyngolaryngo esophagogastrectomies. And I absolutely used to love looking after these patients. I learnt so much from him. I remember being stood behind the curtain with one day, and the patient wasn't very well. And all I was doing was cleaning the wounds and the dressings, and he'd popped his head around the curtain. He was like, "What are you doing?" I was like, "Just cleaning the wounds." But yeah, they're sort of 2 key moments really that I look back on and smile at now.
Just from a human side, Christmas times, especially in the older days when his children were young, and he always made sure that he did come up at Christmas time and see the patients on the wards and bring his children in with him, which the patients used to enjoy and the staff used to enjoy, that time's happening. On intensive care, we used deteriorating patients. If we had a chest opening, it was always very calm and collected, even in those, stressful situations. But yeah, he's always been very nice and very kind to work with.
It's been an absolute pleasure working with you for the 20 plus years, and I'm so thankful to have that opportunity. I've learnt so much from you. You're an amazing person, and this for me is an end of an era. Mr. Cowen as the thoracic surgeon for the unit is all that I've known. So things are going to be very different, but he's done his bit, he deserves the rest, and it's his time now. So, happy retirement.
Yeah, just to say thank you for all your hard work and your support through the time that you've been here and through my career, and just to say thank you. Hope you enjoy your retirement.
He's the best consultant I've ever worked with. I know I can approach him with any questions, ask him anything, and he'll be there to help and support me. He was instrumental in setting up my job role, and I've worked with him for 21 years, I think now. So I remember going to a meeting at the Royal College of Surgeons in London, and out the corner of my eye noticing Mike Cowen standing, I think, to my left, and I thought, I hope he doesn't come and approach me because I won't know what to chat with him about. And he spotted me and went over to me and started chatting. Then we went to the lecture theatre to listen to the lectures. In the middle of the lecture theatre, I looked around to my left, and there he was sat next to me again. Talking about some very complex surgery, and I turned around to him and said, "You don't do that, do you, Mike?" And he said, "Yeah, I do that every day, more or less." And then afterwards, walking back to the train station, he caught up with me again. I was making a quick exit, and I was going to get the underground. He said, "Oh no, don't bother getting the underground. I'll show you the way to go." And we just walked, cut across, and went to the King's Cross station. And that was really my first time I'd met him on a personal basis when it wasn't to do with work and it was outside of work. I do hope you have a long and enjoyable retirement.
I have known Mr. Cowen now for the last 22 years almost. Came to work here when I just came to this country. This was my first place, and it has been an absolute pleasure to work with Mr. Cowen. A fantastic surgeon, very meticulous, very fast, and very good at his work. He used to do heart cases and all major heart cases, and as well as thoracic, so he was good at both of it. Very good, extremely good. And there were many cases where we were called out together in the middle of the night for big cases, and Mr. Cowen was so calm, composed, and did beautiful surgeries. And then he moved on to thoracics. And I must say, from a personal point of view, that he was very, very good with the patients too, because I was a patient myself and I had a surgery by him, and he was so good. He made sure I got the surgery on time. That too, it was during COVID. He took extra care of me, and now everything is fine. But I think he did the best he could for me, and I'm ever so grateful to him and will remain grateful to him for the rest of my life. In short, he's one of our best surgeons ever, and it's very sad that he's going away, but it's good because he's retiring, and wish him all the best for his retirement. It'll be a big loss to the department and to the trust. And I hope we have many more nice surgeons like him.
My experience with Mr. Cowen is before, because I'm, of course, from other country, I was a bit scared to scrub with him because they said that it's quite strict. But then, because if he is under stress on the surgery, he stamps his feet and then he says some swear words, but then he doesn't say it to you, he tells it to himself. But then when you work with him regularly and you know him personally, he is a very nice surgeon. He's a very good surgeon. He's very highly skilled and fantastic surgeon. And not only that, he jokes with you, he makes you comfortable on the table during the operation. And then sometimes if every staff are busy, he himself will be the one to collect the patient from the ward to help his and during the complex procedure like dissection, he is very cool and straightforward, and the procedure will become finished on time, and he's very quick in every procedure that he does. And it's really sad that he's leaving, he's retiring, but I'm happy that he will be enjoying life, and I wish him a happy retirement, and I hope he'll come to visit us one day if he's not busy. He is.
The whole department will miss him very much.
Yeah.
Because as a surgeon, he managed with very few equipment, and his outcomes were the best. Very simple, very thorough, very meticulous. Such a wonderful surgeon. And we in Hull, Castle Hill, have been very fortunate to have him on our board of doctors. Very, very fortunate to have him. And I believe he's one of the best thoracic surgeons in the whole country.
Of course, yes, yeah. I agree
And that's
with
why I
that.
feel so privileged that, you know, that he was there for me when I needed him.
Yeah, I considered myself very lucky to work with him, and it's really my pride to work with a highly skilled thoracic surgeon in this country.
So when I first started here, it was quite a steep learning curve, I have to say, but then he saw me through it. I've known him, started working with him 2002. He's a gentleman in every way. One of the best surgeons that I've worked with. I've had the honour to work with him, and it'll be really sorry to see him go. For me, he listens to you, he respects you as a colleague, and he talks to you rather than down. Every opportunity that I've had with him, sick patients, you talk with him. There have been many sick patients whom we've dealt with together, and he discusses, and as I said, there's no specific day or occasion or patient that I can point out to. It's just an overall understanding colleague to have. And he's a wonderful teacher. So I only hope his trainees will be able to continue his good work.
Hi Mike, it's been a pleasure working with you all these years. I was 28 when I started, now 60, but it's time has passed so quickly. But anyway, good luck on your retirement. It's been a pleasure working with you, and enjoy all your travels.
I've known Mr. Cowen for getting on for probably 25 years. I first started actually covering his clinics as a clinic prep clerk, and back in those days he used to terrify me, I've got to say, if I didn't have his histology results or his x-ray results available. Moving on quite a number of years, I came to manage the thoracic service, which was part of cardiac and thoracic at that time, and we then went through a splitting cardiac and thoracic services. Mr. Cowen did a lot of work to help that go as smoothly as possibly with a number of staff. I've got to say, working with him has been an absolute pleasure. He has been a true gentleman throughout the whole time. I won't say we had our misunderstandings, but we've always managed to work our way through and come out with the needs of the service and patients' care always at the foremost. Mr. Cowen was absolutely instrumental in our robotic surgery and taking that forward, which has put the service on the map, and he's very, very highly thought of throughout the management team, theatres and through our ward staffing. I've got to say, Mike, it's been an absolute pleasure working with you, and I wish you all the very, very best for the future. Please don't be a stranger and contact me if ever you need anything. Best wishes, Tracy.
Hi Mike, it's been my privilege working with you over these last 21 years. I appreciate the help and support you've provided me. I do hope you have a long and enjoyable retirement.
Mr. Cowen, now that you're retiring, congratulations. And we are going to miss you immensely, but we wish you all the very best in this new phase of your life, the next adventure of your life. Wish you every happiness, peace, and good health, and everything that your heart desires. We are going to miss you tremendously. All the best, Mr. Cowen.
All the best. Enjoy life now.
Hi, Mr. Cowen. It's hard to say goodbye, but then I wish you all the best and happy retirement. May you enjoy the touring around Europe, and God bless.
Mr. Cowen is a truly amazing person. He's very, very humble, and he'll be embarrassed to hear that. Amazing person and amazing surgeon who has done a huge amount for me personally and professionally that I'll be forever grateful for. I've got a lot of memories, and I think one of the first times is, and he'll be, as I say, very humble, he'd be embarrassed to hear it, was the first time I saw him operate. It was just incredible. I liken it to a lot of people who don't potentially know surgery or are not familiar with surgery, it's almost like Ronnie O'Sullivan playing snooker. Phenomenal to watch, or Messi playing football, just brilliant. And I've obviously took, over the years that followed, great enjoyment over watching him operate, work to the highest standards and provide the best care for the patients of Hull. I'll miss him hugely. It's a very, very difficult moment for me personally. I know for a lot of people, a lot of our colleagues here are going to be hugely decades of an amazing man, an amazing career that he's had here. It's just going to be hugely missed. All I can do is put a huge amount of time and effort into helping me in life and my career, and just do the best I can for our patients, similarly to what he has done. That's all I can try and do. Thank you ever so much, Mr. Cowen, for everything you've done for me personally and professionally. I'll always be very grateful for what you've done for me, and I just hope you have a very happy and healthy retirement.